very good morning to you and welcome to Dynamic Diet on the Nigerian Television Authority. Dynamic Diet is a multifaceted program that gives you different segments to spice up your weekend. I'm Folashade Famakinwa, and of course, I have my colleague with me.
Well, Folashade, it's nice having you on this program this morning once again. And it's a program that I've always been looking forward to, and I know that even all of you out there, you have been looking forward, and we're not going to disappoint you this morning. I am Niyi Omotenshi saying welcome to Dynamic Diet.
Okay, so what do we have for them today?
Well, I think today we have lots. Let me start with female gender,
Okay, this is our month, right?
Yes. This is the entire the Women Month, where we're celebrating women, where we at least knowing the value of what women contribute to the society and the beauty women bring to the world. And that is why this morning we're going to start on a very interesting note. Folashade, you are a typical example of what
yes, fashion. Fashion has been evolving over the years, and our fabric never goes down. We keep making it better and look better, and women have been able to give it a new look, right?
Yes. Usually in those days when you see certain fabrics, we know that it's going to be for bubairo and the rest. But nowadays, women are trying to at least modernize everything, coming in different designer styles, and that are beautiful. And so we're going to have a feature on women and their different designs and styles of dresses, especially in traditional fabrics. All this we're going to talk about.
And also the entertainment segments.
Wow. The entertainment segment is not going to be left out also. And we have the latest gist and the musicals and the rest things that we are going to spice up your weekend. It's not all about just talking. And of course, the sports segment will not be left out this morning. And the big deal this morning for Folashade was going to be
the weekly mirror segment.
Yeah, that's going to be the big deal this morning.
We have a special guest that will be joining us, so he will be sensitizing us on Lassa fever. Yes, so Nigerian Center for Disease Control has given us some updates on new cases. Just sit back, relax, and get to know what we have for you today. We've lined them up. Please don't miss it. Call your friends, neighbors, and loved ones as we enjoy this show together. So our first port of call is the safety and health segment.
That's not going to be the special feature for our women. Let's take it from there.
So we are my fashionistas. Let's enjoy this segment.
صيام كما كتب على الذين من قبلكم لعلكم تتقون Ramadan oṣù àánú Ramadan oṣù ṣiṣẹ́ ládàgbẹ̀san olóore lẹ́gbẹ̀lẹ́gbẹ̀rún alan ṣàrù karama alábàjọ tiléeṣẹ́ NTA Àkúrẹ́ fi ń pe gbogbo mọ́mìnà láti wá ṣiṣẹ́ olóore nínú oṣù alápọ̀nlé jùlọ ṣonígbàwó ètò Ramadan níléeṣẹ́ NTA Àkúrẹ́ ìrun pípé àyọkẹ́ láti ná Al-Qur'an wá sí lóríṣiríṣi pẹ̀lú ikime pẹ̀lú owó tẹ̀ ní kábàámọ̀ bẹ́ẹ̀ ṣiṣẹ́ olóore nínú oṣù yóò ẹ̀ṣẹ̀ Ramadan ìgbìmọ̀ aláṣẹ àti olùdarí iléeṣẹ́ NTA Àkúrẹ́ ló gbè wá wípé kájọ wá ṣiṣẹ́ ládá òní rẹpẹtẹ ẹ pè Beatrice Jọláyẹmí 08035834282 Babatunde Suleiman 08034874456 Ramadan Sharuabe.
The policy of the federal government of Nigeria promoting the patronage of homemade products has culminated in an unprecedented and increased use of local fabrics to make dresses of different modern, gorgeous designs and styles among Nigerian women.
We can use Ankara to sew gown. We can use damask now. We can use Ofi. People are going back to Ofi. Even the olden style, we are going back to it now, but we are making it different. People are patronize it very well, even more than before. Unlike olden days, then you see mother that did not have more than 5 euro at Yoruba, they will be using one in a week. But this time around, You can. I have customer that if she wear Iro ati Buba once, she may not wear it again. So as long as they are buying clothes, we will be sewing clothes.
Creativity, uniqueness, comfort, simplicity, elegance, outstanding attraction, and promotion of cultural heritage are some of the reasons women fancy this new trend.
Organization, everything is unlike this machine now. The stone machine, we don't have it holding this. The development there is stone. We used to put stone now. We used to use big trimmings when they don't use it before. We upgrade the work, the style and everything, unlike before.
It's just a way of promoting our culture, a Yoruba culture. Any person that sees me will see that this is a traditional person that promotes the culture of the Yorubas.
I'm small, so I don't have big body, so I prefer to wear just short gown, anything gown, or skirt and blouse. I prefer to wear that one. By the time I want to, if I take an Iro and Buba, if I want to tie the Iro, I will find it difficult to tie it. If I walk small, it will loose. So that is the reason behind wearing gown and skirt and blouse.
When you have Buba, I have so many in my wardrobe that I don't wear often. But with this, any occasion I can go with it. With this one, simple, I can go with any occasion with this one. That makes me to sew my own like this. The cost was it because when you consider the cost, you not look nice.
It's just a way of expressing myself. I just want to be creative and I feel good in it. It's also the value of the cloth. You know, ordinarily if you wear it like in Iro and Buba, it might not look, you know, beautiful like this. But once this one is added to it, it, you know, increases the value and makes it more unique and attractive.
Well, thank you for being with us, and we are still on the program Dynamic Diet on the Nigerian Television Operating Channel, Nta Akure, the Dynamic Station. And like we told you before we went on that short break, the time that we are going to talk about Lassa fever, and this is the weekly mirror segment that we have talked about. And now we have in the studio the Ondo State epidemiologist, and who is going to help us to talk about the update on Lassa fever in Ondo State particularly, and in Nigeria generally. Our guest this morning is Dr. Ayo Orimolade. You're welcome to the program, sir.
Thank you so much, sir. Thank you for having me. Thank you for having me. Yes,
Doctor, let's start on this note. What is the update generally about Lassa fever in Ondo State and Nigeria generally?
Yes, I would like to say that Lassa fever, a viral hemorrhagic fever, you know, the peak, the outbreak is usually seasonal. It comes up a lot of times in the dry season. And you know, the vector, which is the rats, a lot of times they leave the bush during the dry season. They come home and they carry along with themselves this virus during the dry season. So that's when we have these outbreaks. And between Edo and Ondo State, we've been having these seasonal outbreaks. Cases of Lassa fever peaks around December, January, February. By March, April, it begins to go down again. And unfortunately, several other states too in the country, like you said, Ebonyi, Bauchi, have also recorded cases. Right now in Nigeria, we are having cases almost throughout the whole year now, and that's why government is also worried too, and government is making several efforts to control this menace. Thank you, sir.
Okay, so we can never overemphasize the causes of this Lassa fever. So, for the purpose of our viewers, can you please sensitize us one more time
The factors
on
that
the factors
contribute.
that contribute to?
Yes, like I said, the major vector is the rodents. The multi-breasted rat has been figured out to be the major culprit in this in propagating this disease, the multimammate natalensis, or let me just call it the multi-breasted rat. It's the major culprit. So what should we do to prevent this infection? The infection takes place when we ingest food that has been contaminated by either the urine or the feces of these rodents. So our food handlers, our food processors, gari processors, what they should do normally is to cover their food. This is not the time you begin to sun dry food like gari just to increase the volume and just to make sales. It's like throwing, now if you do that, it's like throwing stone into the market. You will never know who will get it with that stone. At home too, this is the time that we should put our food into covered buckets.
Proper storage.
Yes, proper storage of food is very, very important now. But I'm just breaking it down. We should have buckets that are things that are transparent, that way we can store our food there. Because when all these rodents pass urine or feces on them and people ingest them, that's the major transmission line for this disease. Also, there's human to human transmission of the disease when you come in contact with the body fluid of an infected person. So this is the time we should maintain what we call the universal precaution. That is, you reduce contact with sick people. We don't say we are not saying you should not take care of sick people, but this is not the time you begin to touch different things, that maybe the vomitors, the stool, the urine of the person who is either vomiting or stooling. And this is the time to maintain proper hand hygiene. This is the time to wash our hands regularly. This is time to also, if you have the alcohol based sanitizer, this is time to apply it regularly. This is time to maintain proper precaution, proper hygiene, personal hygiene of the environment. We should make sure our environment is clean, because these are the issues that propagate these illnesses.
Well, thank you, Doctor. But let's look at what are the symptoms of Lassa fever. If one has got this disease, what are the likely things people will see, either the individual or even the people, signs and symptoms that will make people to really say, oh, Lassa fever is here?
Thank you, sir, for that question. It's a very good question. In the past, what people used to believe that you will see in Lassa fever is bleeding from the nose, bleeding from the hair. I want to say that is the end stage of Lassa fever. By the time patients begin to bleed, it is almost at the end stage of that disease. Chances are that complications are setting. So Lassa fever starts like just the normal malaria with fever. Fever, that's the increase in body temperature above normal. But usually in Lassa fever, the fever is usually high grade. Then you see other things: headaches, general body pain, myalgia, feeling of being unwell. Then they have this muscle pain in the muscles, myalgia. Then some may start vomiting, stooling. Some have chest pain. Some usually have this upper abdominal pain. We call it the epigastric pain, particularly in the younger age group, particularly young ladies. They have this severe upper abdominal pain. Then when it begins to go, it becomes advanced. That's when you see things like bleeding, vomiting blood. You see when injection sites, you see them begin to bleed from those sites. But like I used to say, because I was talking with Mr. Motenche recently, we have been involved in treatment of Lassa fever. in the state for a while now. I want to say that people who have Lassa fever usually have, I call it 2 weeks, with that window of grace, that window of opportunity, that we can intervene and save that life if God permits us. It's usually 2 weeks. So if they present in the hospital, if you can get them to the hospital within that 2 weeks, and we commence the antiviral therapy, it prevents complication and people get well. But when people present late, when they get to the hospital late, the commonest complication there is the acute kidney injury. When it sets in, it makes the treatment extremely difficult. Government has provided dialysis. Yes, it's there in FMCO. Government has provided treatment center here. We have drugs. We have testing, which is free of charge. So we want to appeal to our people that they should have high index of suspicion. They should think Lassa fever. When you are taking malaria now, tell your doctor, sir, I want to test for Lassa fever. Test is free. It's free. Sample transportation is free. Test is free. And I can say boldly that treatment also is free. Even in FMCO, they support things as high as blood transfusion, dialysis, and food when the person is in the treatment facility. So if we can pick the person on time, if the person can get to the hospital on time, Lassa fever is not a death sentence. So these are the symptoms people have. It looks like malaria. That's what our clinicians usually treat. The first week they think it's malaria. Second week they are thinking maybe sepsis, is infection, is typhoid, and all these things, because the body temperature is usually there, but it's usually high grade. You see things as high as 39 degrees Celsius, 40 degrees Celsius. It's usually high. So we want that's another message too. I want also to pass to our clinicians, people who treat people. Please have this suspicion, this high index of suspicion for Lassa fever. When you are treating a case, before people come to the hospital, most of the time they've gone to patent medicine vendor to take drugs, over-the-counter drugs. And when somebody has said he has taken drugs for 1 week, he's getting to you, you have started IV drugs, you have started injection for almost 3 days, and you are changing again. The person has told you he has gone from one hospital to another. He's still having this high grade fever. That's not the kind of patient you now sit upon. You now begin to change antibiotics, begin to change this. Think of Lassa fever. Request for tests. It's available. It's available here in Akure. It's available. Transportation to Owo is being coordinated by the lab coordination unit of the state. So it's available. So we want people to leverage on these things government has made available and get tested and treated on time and prevent unnecessary deaths.
I think, I'm sorry, before Folashade came in, while discussing, you know, I was having it in mind, and you just mentioned it in the person, this culture of self-medication. Because yesterday, when somebody had headache, the doctor recommended this. So today, I'm having headache also, I need to go and do the same thing. Well, yesterday when somebody was having high fever, this is what was used. I need to go and use the same thing. Because from the way you have talked about Lassa fever, it's not something that needs to be prolonged.
No, at all.
Before getting the right treatment. Because within 2 weeks, the complications are setting in.
Yes.
So, what will you say in that manner, at least in that regard, concerning self-treatment, self-medication?
Yes, I want to appeal to our people. We have said it in the past. That our people need good health-seeking behavior. Good health-seeking behavior. There is a health facility available to us. Let's try and make use of it. This is not the best time you begin to treat yourself and keep yourself at home and wait till complications set in. This is the time for you. Get tested, get treated. If you are coming to your health facility to get where you want to get health service, you now can speak up and request for tests in case your clinician is not even suspecting Lassa fever. Like they taught us in medical school, they say common things occur commonly. Lassa fever is a little bit common now in Ondo State. Request for such tests and don't just sit at home. And we are not against our people's taking traditional concoction and all that, and prayer homes. But we are saying, please, this test is available. Government has made it available. Treatment, this drug is also available. Let people get tested and treated on time, because we have that challenge too. Even at times when the diagnosis has been made, you have done the test, molecular test for Lassa fever, and it has been identified. You know, there is a genomic test, even genomic sequencing, they do it. Now, it's a PCR, polymerase chain reaction test. Government has provided all these equipment. And when they do it, you are almost too sure. It's as if you are doing DNA analysis. You are almost too sure this is the illness. You will still see people, they will convince patients otherwise. There was one that still happened about 2 weeks ago in a facility here in Akure. The patient was diagnosed, but it was getting a little bit. We advanced. We transported the patient to FMC or to the ambulance. You'll be surprised that they go to FMC or and a spiritual healer called them, and they wanted to move. You know, we had to send signal. They actually moved out of the hospital. We went to pick them in that spiritual home, and we had to convince the spiritual healer. You yourself can get infected. You can get. We have seen cases of I'm sorry to mention a lot of spiritual people being infected and being treated in the health facility. So our people have to be careful, especially around this time. Now, the treatment is available, testing is available. Please, let's reduce all this self-medication. Let's have high index of suspicion, particularly our clinician. This is not the time you sit on a case. It's getting worse. Fever is increasing, and you still sit on the case. Maybe we are thinking of different diagnoses, or I don't want to say they want to keep collecting money from people, but this is not the time to sit on a case. A good doctor knows when to refer a case. A good doctor knows when to ask for assistance. So it's high time we have that index of suspicion and think of Lassa fever on time. Thank you, ma'am.
So, doctor, now our people, we have this habit of self-medication, like Mr. Omotenshi said. But I've had experiences, you know, in time past with doctors, whereby you have this persistent symptoms, you know, and they've prescribed, and you keep telling them that this thing is not working. In fact, I insisted one time that I needed to, you know, carry out a test, and the doctor was asking me, it's as if I'm teaching him his work. You know, so since you say you have facility for testing, can people just go to the place, if you just, you know, feel that you have these symptoms, and go and carry out the test yourself? You go to the lab and ask them to carry out a request for a test
from the facility.
Well, the test is specialized, like I said, but government is making it available free of charge. But as I speak, we are networking with the private facilities, we are networking with the pharmacists, even patent medicine vendors through the case management pillar in the state, for them to be aware that we have people they call disease surveillance officers. They can get in touch with them easily. These ones will take the sample to the public health laboratory here in Akure, in Batoro Road, inside the IGH facility where we also treat. They can get the samples there from all the LGAs, from all the local government area. They can get it. So if your symptoms is persistent, you can talk to your doctor, and I think that's the proper thing. We should have good channel of communication with the clinician. If he's saying you are teaching him his job, well, you tell him you are in the best place to know, but apparently now I want to get tested. So even the laboratory network, they know who to call, and if they are in doubt, the IDH is there in Batoro. The Ondo State Public Health Laboratory is there. The Ondo State Reference Hospital is there. One can go there and get tested. I've worked there for.
So let's look at individuals now.
Okay, sir.
Sorry. So individuals, they prefer, you know, their own preference of treatment. Like you said, some people will go to the spiritual home, some prefer traditional and all that. And these people are in your environment, they are living amongst you, and you are trying to avoid them spreading it. So is there anybody that you can call, any number or any?
Yes, like I would say, we one major part of our work is, we call it risk communication. In fact, there's a whole pillar dedicated to that in the Emergency Operations Center in public health. What they do mainly is behavioral change communication. It's behavioral change. One of the most difficult things to do on earth is behavioral change. It's difficult to change how people behave, their health-seeking behavior, the way they process food, and it's one of the challenges we have with this outbreak. A lot of people are set in their ways, and even when you think you are communicating, you may not.
You're already programmed to that
way.
That way, where you're talking, someone will be telling you, "Don't leave them."
You've been doing it.
Leave them. They are just speaking grammar.
So, in fact, this year, what we actually did was to embark on what we call community engagement. You know, in the past, you just go and meet people and we start lecturing them with speaking grammar, but we saw that was not getting through. So we called it a community engagement, where you go and meet the real leaders there, the market women, the leaders, the traditional leaders, the religious leaders, the imams, and all these people, and we try to engage with them, what they feel. They are the ones that will tell us what they actually feel. Then we exchange ideas and try to present our facts and see areas where they can align and see reason with all these issues available, because a lot of people do not actually believe in some of these things. When you talk about Lassa, they say they've come again. That's how they came with COVID. But the truth is that the reality is there. Lassa fever is real, and it's if you don't manage it well, it's something that can kill. So we have been trying to engage. We had a stakeholders meeting. We've had almost twice this year, where we called our traditional leaders, called in our religious leaders. We know our people believe more of our religious leaders. So we've been trying to engage with them, trying to engage with the major body saddled with that is, like I said, the health promotion pillar in both the Ministry of Health and in the Ondo State Primary Health Care. And that's what they have been championing. And we are still doing it. We are still moving around. Thank God you brought us here. Now we are using the media, and it's a big platform which can reach out to our people. Please, we are imploring our people that Lassa fever is real. When people have health challenges, please let them get tested and treated on time. And like I said, Lassa fever does not discriminate. It can infect doctor, it can infect the nurse, it can infect pastor, if I infect the man, it can infect anybody. If you break its rule, it will show you the paper. If you touch where you're supposed to put the hand in your mouth, anybody can get infected. So even our people, traditional healers, please, let's have that index of suspicion. Let us think of Lassa fever. So let people get tested. We are not saying you should not pray. We believe in prayers. We are not saying you should not practice the traditional religion. We believe in all that too. But let people get tested and treated. Thank you, ma'am.
Doctor, let me come to this point. This is an area where I know that you health professionals avoid, because you don't want to scare people. But at the same time, we still need to talk about it. Number one, what is the figure like now in the few months? Because we know that there has been a surge recently. What's the figure like? Maybe between so period and so period, we have recorded this number of cases, deaths, and the rest. Then what are the endemic areas?
Okay, sir.
In Ondo State.
Thank God you have said it, that we don't want to create panic in the society, because while we are trying to do like what my boss Osimi Fagemi used to say, that the road to hell is paved with good intentions. When we are trying to do the good, create a media engagement to our people, sensitization. At times when some media houses will bring it out, they just create a panic sensational headline, and everybody feels, oh, what is happening? Lassa fever has killed everybody. Show number of deaths, 10 deaths, 20 deaths, and most of the time this creates panic in in the community, and people begin to ask questions. What is government doing? Meanwhile, government has made effort. I've just mentioned it. Testing is free, provided by government. Treatment is free, provided by government. We are doing a lot of media awareness by government. So we intentionally at times avoid creating that panic. So to be candid with you, numbers usually increase December, January. Are you getting me? But now it's actually going down. It's actually going. This is the normal pattern that we've been having for so long. But occasionally throughout the year, Ondo State still has a few cases, sporadic cases. But it's not like what we had in January or in February. It's actually going. The rains have started now, so it's actually going down. Are you getting me, sir? So, but occasionally we still have cases, but we don't rest on our horse. We will not keep quiet. We will still be going around. Thank God for people like you have brought us here. We will be going around as much as possible to sensitize our people. Please don't drop down your guards, because it's not all the rats that go back. And Ondo State somehow, especially between Edo and Ondo State, has become endemic with this Lassa fever. Once in a while, it still pops up. Are you getting me, sir? So our people should not rest. They should not let down their guard and should not.
And the other part of the other side of the question, the endemic areas in Ondo State.
Okay, sir.
We need to be extra careful. We know everybody needs to be careful, but there could be some areas that in this area for now we are having more cases. So people need to be extra careful.
Yeah, another issue with Lassa fever is the issue of stigmatization. It is also, the stigmatization is almost worse than the HIV in those days. When you hear somebody have HIV, you start beginning to run, COVID, you begin to run. There's stigmatization associated with Lassa fever. And at times, that's why some people don't want to get treated. They say, you want to put me in isolation center. How do I even go back to that house? Especially people living in a community. And at times when we do what we call contact tracing now, when people have, somebody is infected, we want to go there and look for the people who have had contact with such a person. A lot of times we are usually very careful, even to mention it. We see had a case recently. We went there with our, I think the official vehicle, and we were moving around talking to people. Up till now, the person that was infected in that house cannot go back to the house. They stigmatized the person. He said, the woman said, my daughter cannot go home now. That when she's walking, people begin to look at her. You know, so such cases are sensitive. So we know there are some LGs that are endemic. There are some LGs that are endemic. But now we are getting scared. Why we are getting scared is because somewhere like Akure South too is now being involved. In the past, you know, it came in through Edo State, Ose, gradually Owo. But now we are having cases now too in Akure. And that's why we are worried, and that's why we are shouting, and that's why we are moving around. That we don't want it to spread in Akure because of the population in Akure. We have a lot of, most civil servants, even civil servants, a lot of them reside here. And from there they go to different parts of Ondo State. Now we have an airport here. Somebody can be here around this time by 12 o'clock. It can be in Abuja. It can be in Lagos. And before you know it, it's in maybe America or London. Any infectious disease is just a flight away. It's just a travel bus away. And that's why we are being very careful, because now we are recording cases too in Akure, as well as Akure South. But we don't want us to stigmatize maybe a particular area of people, but we are sensitizing everybody around. Anywhere you can find rats, that area is prone to Lassa fever infection. We did the ratization in Akure, you know, a few months back, and you may want to know, sir, that almost 40% of the rats that were harvested and buried, almost 40 was these multi-breasted rats. So that's why we are saying our people should be careful with safety of food safety is very important. Please cover your food. This is not the time to keep your rice, you keep your grains exposed at home. Please keep them in well covered buckets. Even your yam, find a way of keeping them away from the rats. Thank you, sir. I hope I've answered a little bit of your question.
Okay, thank you very much, Dr. Awe. If we continue, time can never be enough, and we can see that our time is already fast spent. There are other things to attend to on this program. Thank you for being our guest this morning. But before you leave, what is going to be your parting word on this program this morning?
Okay, thank you so much, sir, for having me. Two things mainly. Number one, our people should have high index or suspicion for Lassa fever. Please, when you are thinking about malaria, also think about Lassa fever. When people develop fever, high index or suspicion. Number two is, they say cleanliness is next to godliness. Let's keep our environment clean. Let's keep our homes clean. Personal hygiene, environmental hygiene. Thank you so much, sir. Thank you, ma'am.
All right, so thank you so much for being on the show, sir. And I hope we have been able to learn from what Doctor, disseminated to us. If you see something, say something. Maintain proper hygiene and sensitize people who are around you about Lassa fever. Dynamic Diet continues shortly with our entertainment segment. Do stay with us.